Okay, I'm going to be using this Pillow Pet as my newborn today for my newborn assessment. So I'm going to enter the room, do my hand hygiene. I'm going to check my infant's wristband with the mother's wristband, making sure those numbers line up. Patient safety. So my baby, he's not crying right now, so this is perfect time to get some accurate vitals because crying would create inaccurate vitals. So I'm going to collect a heart rate for a full minute, apical heart rate for a full minute. And this should be between 110 and 160, which is normal. And then I'm going to get my respiratory rate. I'm going to watch its chest rise, and this should be between 30 and 60. Okay, I want to get these while my newborn is calm, because I don't want them to be inaccurate. I'm going to get an axillary temperature. This should be between 97.7 and 99.5 Fahrenheit, which is normal. Okay, I got 98.1, which is normal. While I have my stethoscope out, I'm going to listen to the baby's lungs. Go on the back, from side to side, listen. You can hear full expansion. They're clear bilaterally. I don't hear any crackles or wheezing. You can listen on the front too. Okay. While I have my stethoscope out as well, I'm going to inspect the baby's abdomen. I'm going to listen to each quadrant. I inspect it to see if there's anything abnormal with the skin. That's what I'll be doing throughout the whole assessment. So I hear some gurgles within each quadrant, which is normal. It's good to hear gurgles. There's some action going on in there. Okay, so lungs sound great. Quadrants sound great. While I have this open, I'm going to look at nipple line. It's good. I don't see any skin variations. I'm going to do my cap refill within 3 seconds, which is good. I had 5 digits. I counted them. I'm going to count these digits on the feet. Got 5. Cap refill is within 3 seconds as well, which is good. I'm looking at my gluteal folds as well. They appear to be equal, which is normal. We want to see that. I'm going to go up and look at its eyes. I don't see any drainage, which would be abnormal. Looking at the nasal nares, they're patent. You want that so air can come in and out, and they're open, which is great. No mucus blocking them or anything like that. Look at the top of the pinna, make sure it lines up with the correct. Top of the pinna should line up with the eyes, so that's correct. And the baby's head appears to be larger than the chest, which is normal. Now I'm going to feel its anterior fontanelle, which should be soft, smooth. It should not be bulging or dented. Feel for its posterior fontanelle. It should feel smooth. The anterior is the one that closes last, and then this one closes within 2 to 4 months. Okay, so, and we usually collect an APGAR score at 1 minute and 2 minutes, at 1 minute and 5 minutes. So, based off their appearance, so skin color, tone, pulse, grimace, activity tone, and respiratory rate. So my baby appears to have acrocyanosis, which is normal within the first 24 hours. His extremities are just a little bit blue, so he's going to get a 1 for that. My baby's pulse was 145, which is normal, so he's going to get a 2 for that. Grimace, I see him flexing, he's crying a little bit, he's going to get a 2 on that, because I observed that before he got sleepy. An activity, I can see him bending his arms, he's willing to move around, gets a 2 for that. And his respiratory rate was, I believe, 55. So this infant is going to get a 9, I believe, because he's got a little blue going on in his hands and feet. But like I said, that's normal and that should go away. And I don't see any other skin variations. See any drainage? I'm feeling for his spine. It feels nice and straight to me. I don't feel anything out of the norm. I want to look at its hips. Those gluteal folds are equal. You can bend those hips. I'm going to look at the genitalia as well, so I don't see anything abnormal with the penis structure. Like there can be abnormalities with placements of certain parts of the penis, but this penis looks normal to me. And check its stomach. And check its buttocks. In clinical, I had to clean up some meconium because it wasn't all cleaned out, so wipe out that meconium. Don't see any abnormal colors or anything. I'm gonna do a reflex, the Babinski, so I'm gonna scrape the side of the infant's butt. His toes go up. Do the other one, his toes go up. And everything appears to be normal with my newborn. And that completes my assessment.